Hey everyone, this is Dr. Ezra with Integrative Kidney Institute, and today I'm going to be talking to you about the June edition of our Integrative Kidney and News. So let's do this. But before we begin, make sure you press the subscribe button and the notification button so that YouTube notifies you when a new video comes out on our channel. All right, there has been so many studies that we looked into and we curated them for you, and we have them in this video. The first one looked at the DHA-containing diet and found that potentially it might halt the progression of kidney disease. So before we talk a little bit about the study, I want to give you a little bit of background because the study talks about arachidonic acid and docosahexaenoic acid, which basically is DHA. So arachidonic acid is basically omega-6 fatty acid. It's found primarily in meat, egg yolk, and plays an important role in brain function, muscle growth, and it's a precursor of icosanoid. These are signaling molecules that involved in the body's immune system and inflammatory response. So DHA is an omega-3 fatty acid. You heard about omega-3 fatty acids. It's mostly found in fatty fish oil supplements, flaxseed, and walnuts, and certain algae. It's crucial for eye health and for brain health, and there has been studies that show that they are beneficial for cardiovascular morbidity and mortality. They improve triglycerides and blood pressure control. So one is arachidonic acid, omega-6 fatty acids, and then DHA, which is omega-3 fatty acid. So the study was a basic science study. So they used rats here, and they looked at giving them a diet high in DHA. So they used this 5 out of 6 nephrectomy rat. Basically, these rats, they took 5 out of 6 of their kidneys and they left them with 1/6 of their kidneys. And they gave one group the ARA and another group they gave them DHA. And they measured urine, plasma, and kidney samples for signs of oxidative stress, inflammation, and fibrosis. They found that nephrectomy led to surge in urinary albumin excretion, indoxyl sulfate, reactive oxygen species, TNF-alpha, and kidney fibrosis. They found that rats that were fed DHA-containing diet has significant decrease in all these parameters than those who were fed ARA or omega-6 fatty acid. So DHA-containing diet could be a promising strategy to suppress the progression of chronic kidney disease. We cannot do these kind of studies on humans, obviously. And the next study looked at outpatient antibiotic use for first-time symptomatic kidney stone patients. So this is a population-based case control study. It was done in Minnesota, collecting data from 2008 to 2013. They looked at 1,247 individuals. They looked at their chart, basically, and they looked for those who have first-time symptomatic kidney stones. And they compare them with 40, 24 age and sex matched control. And they analyzed the prescription for outpatient oral antibiotic use within 5 years before they had symptomatic kidney stones in both the cases and the matched control. And they found that the risk of symptomatic kidney stones increased only after the first year of taking an antibiotic. But the risk decreased when they adjusted for comorbidities. And they also excluded cases and controls that had prior urinary symptoms that could have warranted antibiotic prescription due to undiagnosed kidney stones. And they found that if they adjust for those or they exclude them, the increased risk is completely gone. And these outcomes were consistent across different antibiotic classes and the number of antibiotic courses taken. So the study suggests that the perceived risk of first-time symptomatic kidney stones associated with antibiotic may be largely attributed to the comorbidities and to the urinary symptoms that led to the prescription of antibiotic. This is called reverse causality. Basically, the researchers saying that it's not that the antibiotic is causing the kidney stones, but the kidney stones and their symptoms are causing the use of antibiotic before diagnosis of kidney stones. So this conclusion obviously is contrary to the theory that antibiotic can modify the GI microbiome and can contribute to kidney stone formation. And there have been a lot of studies that confirm that in the past. But as the title suggests, the study did not address asymptomatic kidney stones. They did not look at x-rays and to see if some patients have kidney stones that are not symptomatic. And they did not look at recurrent kidney stones. And the researchers pretty much cherry-picked their exclusion criteria. They excluded people with urinary symptoms who could have true UTIs or true other causes of urinary symptoms than kidney stones. And that's what probably, in my opinion, led to this negative association. And the third study is actually my favorite study. This study looked at the incidence of idiopathic nephrotic syndrome during the COVID-19 pandemic in Paris area and in the Netherlands. They looked at the incidence of idiopathic nephrotic syndrome. If you're not familiar with idiopathic nephrotic syndrome, basically is one of the manifestations of glomerulonephritis or autoimmune kidney diseases. And basically, they looked at the incidence of nephrotic syndrome before the COVID pandemic and during the COVID pandemic. And they found that there was no significant difference in the incidence of nephrotic syndrome before or during the pandemic. But during the period of lockdown, when the schools were closed, there was a significant decrease in incidence of idiopathic nephrotic syndrome. And that coincided with a decrease in respiratory viral infections and decrease in air pollution. So the researchers themselves thought there might be potential link between nephrotic syndrome onset or autoimmune kidney diseases and viral infection and or environmental factors. What do you guys think? And then finally, this last study is also a good study, actually. It compared the very low-carb diet with the DASH diet for overweight or obese adults with hypertension, prediabetes, or diabetes. So this is a randomized trial that looked at those high-risk individuals with hypertension, prediabetes, diabetes, obesity, and overweight people. And it's pretty much a small study. It was 4 months long, and they looked at 94 adults from Southeast Michigan. They found that compared to the DASH diet, the very low-carb diet resulted in greater improvement in systolic blood pressure, almost 10 mmHg lower. The DASH diet, which is about 5 mmHg. The glycated hemoglobin was lower. Weight loss was better with the very low-carb diet. And they also found that adding extra support strategies such as mindful eating, positive emotion regulation, social support, cooking did not really affect these outcomes. So this study suggests that the very low-carb diet might offer more effective disease management strategy than the DASH diet. I look forward to seeing more and more of these studies with a larger population and a long-term follow-up than this study. But this is very promising. So I hope you like this video. If you like it, make sure you share it with people who might benefit from it. Make sure you follow us on Instagram at Integrative Kidney, on Facebook at InKidney, and on LinkedIn at Integrative Kidney Institute. And we're also on www.inkidney.com.